Okay, let's talk about positions, planes, views, and terminology used in reference to the human body. Now, the first one, what we're going to learn today is about position. What is a position? Now, positions can be of three types: anatomical position, supine position, and prone position. Anatomical position. If you look at the picture over here, you can see a person who is standing straight, eyes are looking forward, both arms by the side and the palms facing forwards. Both feet are together. This position is called as the anatomical position. The next position is the supine position. Supine position is when a person is lying his or on her back with the arms by the side, palms facing upwards and feet together. The third position is the prone position. Here the person is lying on his or her face, chest and abdomen, and this position is called as the prone position. What are planes? Now planes are lines which passes through various parts of the body. If a plane is passing through the center of the body, dividing it into two equal parts, that is called as a median plane or a mid-sagittal plane. A plane which runs parallel to the mid-sagittal plane is called as the sagittal plane. A plane which is at right angles to the sagittal or the median plane and divides the body into an anterior and posterior half, it is called as a coronal plane. Let's learn about some terms which are used in relation to the trunk. Now, ventral or anterior is the front of the trunk. Dorsal or posterior is referred to as the back of the trunk. Median is a plane close to the median plane or the mid-sagittal plane. Anything which is away from the median plane is called as a lateral plane. The words proximal, cranial, superior is used when you are referring to the end of the body which is towards the head. Distal or caudal or inferior when it is towards the lower end of the trunk. Superficial if it is close to the skin or towards the surface of the skin. Deep if it is away from the skin or away from the surface of the body. Example for a structure which is superficial is the skin or the hair follicles, the sweat glands. Example for structures which is away or deep are heart, the lungs, the kidneys, etc. When we are referring to structures on the same side of the body, it is called as ipsilateral, and when we are referring to structure from another side of the body or the opposite side of the body, it is called as contralateral. Ventral or lateral is used in terms again for the front or for the front in terms of the trunk as well as for the upper limb as well. So if you look at this picture here, when the upper limb is facing palm upwards, that is called as the ventral or anterior, and the part of the upper limb which is facing posterior is also called as the dorsal. The medial border is referred to the line along the little finger. The little finger and the medial border of the forearm and the arm. The lateral border follows the thumb, the lateral border of the forearm and that of the arm. Proximal is anywhere close to the root of the limb, while distal is anything away from the root of the limb. So the arm is going to be a proximal structure, whereas the hand is going to be the distal structure. The palmar aspect is the front of the palm. The dorsal aspect is going to be the back of the palm. Flexor aspect is the front of the upper limb, and the extensor aspect is going to be the back of the upper limb. So when you're saying the flexor aspect, for example, when you bend your upper limb at the level of the elbow, that part which comes, the forearm which comes close to the shoulder, that part of the upper limb is called as the flexor aspect. and when you extend the upper limb, that is when you extend the joint at the elbow, the part of the upper limb which moves away from the shoulder, that is the back of the arm or the posterior aspect, that is referred to as the extensor aspect. Now some terms which are used in relation to the lower limb. Again, posterior is referred to in the back of the lower limb. Anterior is referred to as the front of the lower limb. So posterior here is going to be, in layman's terms, the back of the thigh and the back of the limb. And anterior is going to be the front of the thigh and the front of the limb. The medial aspect lies or it runs along the great toe. The great toe is also referred to as the hallux in anatomical terms. So the medial border lies along the hallux, the medial border of the leg and the thigh. The lateral border lies along the little toe, the lateral border of the leg and the thigh. When referring to the lower limb, the flexor aspect here is going to be in the back of the lower limb, and the extensor aspect is going to be in the front of the lower limb. Proximal again is referred to close to the limb, and distal is going to be away from the root of the limb. So the thigh is going to be a proximal structure, the leg and the foot is going to be a distal structure. When you bend the lower limb at the knee joint, there is flexion occurring at the knee joint and extension occurring at the knee joint when you extend the lower limb. So what are the terms which are used in relation to body movements? Now movements are generally occurring at joints called as the synovial joints, and that can be of four types, that is the gliding movement, angular movement, rotation and special movements. What is a gliding movement? So when you have flat surfaces, for example, the bones in the vertebral column. The bones in the vertebral column are flat. Each vertebra is a flat structure, and between each vertebra there is a structure called as an intervertebral disc. Now this intervertebral disc will allow the forward and the backward movements of the corresponding vertebra. So when you bend forwards, the vertebra, they glide forwards, and when you bend backwards, the vertebra glides backwards. So here what happens is flat surfaces move back and forth, or they can also move from side to side with respect to another movement, and the angle between the articulating bones does not change significantly. The next type of movement is the angular movement. Here in angular movement, there are angles formed between articulating bones. So the angles can increase or decrease. When you flex, that is in flexion, there is a decrease in the angle between the articulating bones, and when there is extension is happening, then there is an increase in the angle between the articulating bones. Example for flexion again, or angular flexion, is going to be example is the elbow joint. So when you bring the when you bring the forearm in close contact with that of the arm, their flexion happens, and the angle between the bones of the forearm and the bones of the arm reduces. So that is flexion movement. And when you extend the elbows, the angle between the forearm and the arm increases. The next movement is lateral flexion. So when there is a movement of the trunk sidewards. So when you say trunk, we are referring to the thorax and the abdomen together. So when the trunk moves sidewards, either to the right or the left, it is called as a lateral flexion. So in terms of the trunk, there is only going to be lateral flexion to the right, and to the left there is not going to be there any medial flexion. The next word is adduction. Adduction is movement of the bone towards the midline, whereas abduction is movement of the bone away from the midline. The next movement is going to be rotation. What is rotation? when a bone revolves around its own longitudinal axis, it is called as rotation. In medial rotation, the anterior surface of the bone of the limb is turned towards the midline, and in lateral rotation, the anterior surface of the limb is bone towards the away from the midline. So in medial rotation, for example, if you keep your arm straight and the elbow flexed at 90 degrees, if you move your forearm towards the body or towards the chest, it refers to as medial rotation. And if you turn the forearm away from the chest, that is referred to as the lateral rotation. Then there are something called as special movements, and they occur only at certain joints. For example, pronation and supination at the radioulnar joints. Radioulnar joints. Now, radioulnar joints are found at the distal end of the forearm as well as the proximal end of the forearm. Now, when you're saying pronation, the palmar aspect of the hand is facing downwards. So that is pronation. And when the palmar aspect of the hand faces upwards, that is called as supination. And these two movements, pronation and supination, occurs at the radioulnar joints. Another example for special movement is movements happening at the temporomandibular joint. So temporomandibular joint is the joint. It's also referred to as uh, the jaw joint. Okay, it happens between the maxilla and the mandible. So when you open the jaws or when you open the mandibles and push the jaws forward, that is called as protraction. And if you bring the jaw backwards, that is called as retraction. Now these special movements occur only at the temporomandibular joint. So if you look at the first picture over here, this picture here, you can see the hand. This is the dorsum aspect of the hand. If it moves along the ulnar aspect, that is along the little finger, that is the medial side. And if you trace it along the thumb, it is called as a radial side. Now this picture is an example of a gliding joint. So if you move the dorsum towards the ulna or towards the radial side, that movement is called as the gliding movement. If you look at this picture over here, this picture shows the action called flexion. Here the palm is coming towards the arm here. So see, if you look at this picture here, the palm is coming towards the arm. That movement is called as a flexion. And if it goes away from the arm, it is called as extension. If you compare the movements in the upper limb and the lower limb, you can see the movements are going to be in the opposite direction. If you look at flexion in the lower limb, in flexion you bring the leg, or you bring the feet towards the thigh. That is called as flexion. And if you bring the feet away from the thigh, that is called as the extension. So if you compare to these two pictures here, flexion here in the upper limb occurs towards the arm, and flexion in the lower limb occurs in the opposite direction, and it goes posteriorly towards the thigh. If you look at the whole of the upper limb, if you bring the whole upper limb forwards, that is called as flexion, and here flexion occurs at the hip. If you bring the whole of the upper limb posteriorly, that is extension, and it can also be hyperextension. The same thing can be used at the shoulder joint here. If the whole upper limb is extended and brought upwards, that is called as flexion, and if it is taken backwards, it is called as extension. Here the flexion and the extension occurs at the shoulder joint. In this picture, the flexion and extension occurs in the elbow joint here. Now two movements, rotation, right rotation and left rotation. Here the movements are occurring at the cervical vertebra. So there is rotation occurring towards the right side and rotation occurring to the left side. This picture here shows pronation and supination. The palm which is facing upwards, that is called as supination, and when the palm is facing downwards or the palm is posterior, that is called as pronation. Now the movements in the upper limb, like I told you, when the flexion occurs when two flexor surfaces are brought close to each other. Example, in the elbow joint, when the front of the arm and the forearm are opposed to each other. Then there's extension when the extensor or dorsal surfaces are brought in much approximation, that is when they straighten out the arm. Abduction. When the limb is taken away from the body, it is referred to as the abduction. When the limb is brought close towards the body or close to the trunk, that is referred to as circumduction. That is referred to as adduction. In circumduction, the movement occurs in the upper limb and lower limb, and it occurs in the shoulder joint and the hip joint here. Now here what happens is the distal end of the body can be moved in a circle. So it is a combination of extension, abduction, adduction and flexion, and this happens in a sequelae. A combination of extension, abduction, flexion and adduction which occurs in a circulae is called as a circumduction. For example, while bowling a cricket ball, that is that the action there which happens in the shoulder joint is going to be circumduction. Then there is the medial rotation. When the arm rotates medially, bringing the flexor forearm close to the chest, that is called as medial rotation. When the arm rotates laterally, taking the flexed forearm away from the body, it is called as lateral rotation. Supination is when the palm is facing upwards, and pronation when the palm is facing downwards. Abduction when it of the digits of fingers. Now the fingers can also be referred to as digits. So when the fingers are brought together, it is called as adduction. When all the fingers separate, it is called as abduction here. Then the thumb has two special movements called as opposition and circumduction. In opposition, what happens is when the tip of the thumb touches the tips of the other fingers, that movement is called as opposition. Circumduction of the thumb happens when there is extension, abduction, flexion and adduction happening in a sequence. So if you can look at the first picture over here, there is flexion here, flexion and extension. Abduction when the upper limb is taken away from the body, that is called abduction. When it's brought towards the trunk, it is called as adduction. Medial rotation when it's brought towards the chest. Lateral rotation when it's taken away from the chest. And the last picture here shows circumduction. That is, there is extension, abduction, flexion and adduction. So it is a circular movement which happens here. So abduction, adduction, medial rotation, lateral rotation, flexion, extension, and then you have circumduction. In the lower limb, again, you can have the same movements. There's flexion of the thigh when the front of the thigh comes in contact with the abdomen. Extension of the thigh happens when the person is standing erect. Abduction when the thigh is taken away from the median plane. Adduction when the thigh is brought close to the median plane. Medial rotation is when the thigh is turned medially, and lateral rotation when the thigh is turned laterally. Flexion of the knee happens when the back of the thigh comes in contact with the back of the leg. Extension of the knee when the thigh and the leg are in straight line as in standing. Dorsiflexion of the foot when the dorsum of the foot is brought close to the front of the leg and the sole faces forwards. Plantar flexion happens when the sole of the foot and the plantar aspect of the foot faces backwards. Inversion is when the medial border of the foot is raised from the ground, and eversion is when the lateral border of the foot is raised from the ground. So if you look at the movements of the lower limb, extension, extension and flexion. Flexion when the lower limb is brought forwards. Then when if you bend the lower limb at the knee, or when flexion happens at the knee, the leg is brought close towards the thighs. If you look here, this is the adduction when the whole of the lower limb is brought towards the median plane. When the whole of the lower limb is taken away from the median plane, that is called as abduction. And you have a circular movement here, that is called as adduction. Now in the neck, there are again certain movements happening here. Flexion when the face comes in contact with the chest, this is flexion. Extension when the face is brought away from the chest. Lateral flexion when the ear is brought close to the shoulder. Lateral flexion can be on the rightwards and on the left side also. Rotation when the neck rotates, so the chin is brought in the opposite direction. So if you look at the picture here, this is rotation. The chin is brought to the opposite direction. Again, rotation can be towards the right and towards the left. Then you have opening of the mouth, that is the movements happening at the temporomandibular joint. Closure of the mouth again happens at the temporomandibular joint. Protraction and retraction again, these are special movements and they happen at the temporomandibular joint. The movements of the trunk. If you look at the picture here, this is lateral extension when whole of the trunk bends sidewards. Rotation when the whole of the body rotates, when whole of the trunk rotates with the lower limbs standing straight. Bending of the trunk forwards is called flexion, and bending of the trunk backwards is called as extension. Thank you.